Our final guest of the day is Dr. Scott Colquhoun of Wilmington Health. Welcome to the show, Dr. Colquhoun. It's a pleasure to have you here.
Well, thank you. Thanks for inviting me.
You're welcome. Let's start with you and your education and your background. Tell me a little bit about that.
Well, I'm from California, but I've done a lot of my training out east in Georgia and Charleston, South Carolina, and Jacksonville, Florida. Then I was a Navy doctor for 3 years and really enjoyed wearing the uniform and serving my country and getting to travel and getting some good experience.
Oh, that's great.
And then came back to Jacksonville, Florida, and started looking for jobs. And my wife is also a physician, and we just settled here in southeastern North Carolina.
Where did you go to medical school?
At the Medical College of Georgia in Augusta.
Augusta. Yeah. And your residency?
In Jacksonville, Florida. Internship in Charleston, South Carolina, and then residency in Jacksonville, Florida.
And you've just been around a little bit.
Yeah, it's been fun.
I understand that you're located in 2 or 3 places. You have some satellite offices. Tell me a little bit about that.
Yes, ma'am. We have a satellite in the Brunswick Forest Clinic.
Right.
And we also have a satellite up in Jacksonville. Being a former Navy doctor, I really grew to appreciate taking care of young Marines.
Sure.
And a lot of my sports medicine practice comes from those patients from the base. So that's another clinic I enjoy.
I'm sure you do.
But it is a bit of a drive, but it's worth it. So.
Great. Well, that's wonderful information. Thank you for sharing that valuable information about Wilmington Health. But the main focus of our interview today is to learn more about that specialized type of knee replacement that you offer. First, tell me how you decide a knee replacement is what's necessary.
Well, it's usually after seeing a patient several times and getting to know them and examining them and looking at their radiographs and then beginning conservative treatment. And, conservative treatment consists of ice, heat, rubs, wraps, various anti-inflammatory medications, pain medicine, steroid injections, joint lubrication injections.
Wow.
There are a lot of things we can do to help patients without surgery.
Right.
But sometimes patients come in, they've already had all that, or I've been taking care of them for a few years, and we've exhausted all those conservative measures. And when patients start having night pain, when they have pain with their activities of daily living, when they're unable to walk for fitness and take care of the rest of their body, then it's time to consider joint replacement surgery.
I see. I didn't realize there were so many avenues prior to the surgery.
There are, and we exhaust them, and our patients appreciate that.
I'm sure they do.
Yeah.
And I understand that there's many different kinds of knees out there.
There are.
And so we're going to talk about a new type of knee today and something that you offer. I hear you're one of the first physicians in the nation to provide this type of knee surgery.
That's right.
And so I think it's called Visionnaire patient match technology.
That's right.
It's kind of cumbersome, but tell me what that is.
Well, what we do is we try to match the size implants to the patient using an MRI, a limited study without a radiologist reading it, and an X-ray. And the MRI and X-ray data gets fed into a computer. It tells us exactly what size parts to use, exactly how they need to be aligned, and most importantly, and I'll show you here, it creates these custom blocks to use during the procedure. They're individually made for each patient to the anatomy of their knee. And for instance, if this is a patient's distal femur, or the top of their knee joint, this block snaps on only one way, and then it allows us to make our first cut to go ahead and start the procedure on the right track. It also sets the rotation for the components on the femur as well. We use something very similar for the tibia. And I still go ahead and double check things with some old-fashioned instruments just to make sure that maybe there's not been make sure there hasn't been a mistake with the computer software, and I want to make sure everything's done right. But these blocks are pretty accurate. I've been pretty pleased with them.
Now, so are these particular things ordered prior to the surgery? You do the MRI, and are these cut to fit prior to going to surgery?
Yes, ma'am. We get the the limited MRI and the one full-length X-ray about 3 weeks prior to surgery.
I see.
And that gives the computer time to reconstruct all the images and make these on blocks that come sterile from the factory. And then we open them up on the back table with all the new parts, and we use them.
So it's like a custom fit.
It is a custom fit.
So what might be benefits from using the Visionnaire knee replacement in comparison to a regular knee replacement?
There are a lot of benefits. First of all, in my hands, it cuts down on the surgery time tremendously.
Oh, I never thought of that.
It's much more efficient. It saves about 22 steps, roughly. Also, there's less instrumentation or less invasive type of measuring during the surgery. For instance, I don't have to drill a hole in the distal femur and run a rod up the femur to find out the alignment. I can simply put the block on instead. So it's a little less invasive. And I just think it's a much more efficient way to do the procedure. There's a lot less instruments on the back table, so it's much easier for the OR staff and the hospital. There's much less equipment to turn over.
How long would this procedure take?
The procedure takes on average about 45 minutes.
That's short.
It's I think it's enough time to do a good job.
Right.
But it's also efficient. And it's not uncommon to do one of these procedures on a thin patient with not a whole lot of deformity in a little over 30 minutes.
Wow.
And sometimes it can take up to an hour or so. But usually on average about 45 minutes.
That's not too bad then.
More than, 45 minutes we're putting in our closing sutures.
And what would be the recovery time for a typical patient getting one of these? What would be the typical recovery time?
Well, the recovery time varies. And
I'm sure it does.
And that's something that I'm actually really interested and excited about, because we've come a long ways in the last few months, really. We attack the patient's pain from a lot of different angles. During the surgery, we give them some IV Tylenol and then an IV anti-inflammatory. We also inject medicines around the lining of the knee joint. And then at the conclusion, we put on a TENS unit. And all those different modalities really help a lot with pain.
Those patients getting these Visionnaires, you're able to do this procedure at Brunswick Novant Medical Center?
Yes, ma'am. Brunswick Novant Medical Center has negotiated a contract with the company that offers this Visionnaire technology.
Great.
So they get a competitive price for the Visionnaire technology. But also of importance is they've also contracted with the company to get the 30-year knee. And the 30-year knee is not a marketing gimmick. This is special material that when tested in the lab to simulate 30 years of wear, it holds up. And the FDA has approved this company to label this knee as a 30-year knee.
Wow.
And I'm pleased to offer that to patients at Brunswick Novant Medical Center. And to me, it's worth a drive, a little bit extra time driving to go down and operate at Brunswick Novant Medical Center and to round on the patient's post-op to give them the best parts. I think they deserve it.
That's wonderful to hear. I'm so happy that you're pleased with the services that are provided to you at Brunswick Novant Medical Center.
I truly am. We have a great team. It's a beautiful facility. The patients, a lot of them, I've brought patients from Jacksonville and from Wilmington, and of course patients from Brunswick County, but some of them have never seen the hospital before. They're not sure what to think, but I have had excellent reviews from the patients. They recommend the hospital to their friends. Overall, we've been very, very pleased.
Great. Well, it was a pleasure having you here today. Please let our viewers know how they can reach you and to schedule an appointment or an evaluation.
Sure. I'll be happy to go ahead and have them call the clinic at 910-341-3455.
Great. Well, that sounds wonderful. And thank you so much for being here today. It was a pleasure to meet you. And it was interesting, very interesting to learn about all these new products.
It's cool stuff. Thanks.
It is cool stuff. Yeah. Thank you.